Hi, this is Nissa Takaria, and before I do start my checkoff, I want to scan the room real quick. Alrighty. Just a warning before I do start. I am filming by myself today, so I'll be having to move the camera around back and forth. So I'm not going to try to break sterility, but I will have to move the camera back and forth. I will say it when I do, just in case. Again, my name is Nissa Takura. Here's my student ID. And today I will be doing my wound care and hand hygiene checkoff. So I have already checked with the hospital policies, and I have my order form right here. Today we'll be using two identifiers to identify our patient today. The first of which will be his name, and on his wristband I see his name is Jaguar J. Jones, and that name matches my order form. The second identifier is going to be his date of birth, which is 08/25/1963, and the date of birth matches my order form and my wristband. So both of the identifiers, the name and date of birth, match the order form and the wristband, so that is good to go. The next thing I will assess is his allergies. On the order form, I see that he is allergic to penicillin, and that allergy matches his wristband. So now I'm going to ask Mr. Jones if he is allergic to anything else. Mr. Jones, are you allergic to anything else that you'd like me to know about? No? The patient has stated that he is not allergic to anything else, so now I will give Mr. Jones some privacy while I go perform hand hygiene. Moving the camera around. So before I do begin hand hygiene, what I want to do is I want to check for any jewelry and push back my sleeves if I had any. And I want to check my nails, make sure they are within limit or within cut good. And then I want to check my hands for any lesions, cuts, or abrasions. So the next thing I want to do is I want to cut the water onto a good warm temperature. So once it's at a warm temperature, what you're going to do is wet your hands one by one. Next thing is get about 3 to 5 milliliters of antibacterial soap. So 1, 2, 3. And then what you're going to do is you're going to do 5 circular motions on each palm. 5 circular motions on the other. 5 circular motions on the top. 5 circular motions on the other top of the hand. You're going to clean the nails. You're going to interlace your fingers. And this process should take about 15 to 20 seconds, all while keeping my hands below my elbow. So the next thing is that you're going to wash off the soap thoroughly, one hand at a time. And same thing with the other hand. So afterwards, you're going to get a paper towel, and you're going to dry your hands from fingertips to wrist. And what you're going to do is dispose of that. Grab another paper towel, and you're going to do the same thing and go from fingertips to wrist and dispose of that. And you're going to get this last paper towel, and you're going to turn off your faucet and dispose of that. So the reason I used soap and water is because my hands are visibly soiled, and I may have come in contact with the spore-forming microorganism, such as Clostridium difficile. So now what I'll do is I'll take my trash can, move it over here, and I'll move it to my workstation. Just adjust the camera. So now that I did grab the trash can, I will need to perform hand hygiene once again. So now I will perform it with an antiseptic hand rub. So 2 reasons for performing antiseptic hand rub is because my hands were not visibly soiled, and I would use it before and after putting on gloves. So now what I'll do is I will move the patient up to a comfortable height. I will pull down the guardrails, and I will make sure the patient is as comfortable as possible. So now what I'll do is I will put on my goggles and my glasses, and my goggles will go first. So now that I have my goggles on, I will put on my gloves. And just adjust them. So now what I'll do is I will push back the linens and gowns, and I will expose the suture line and the open wound. And I will do this while maintaining as much privacy as possible for Mr. Jones. So now what I'll do is I will pull back the ABD pad, and I will make sure to do corner to corner and pull this inward like that. Take off the 4x4 gauze. And right here, I will assess the type, the amount, the color, the consistency, and the odor of the drainage. So now what I'll do is I'll go into the wound and I will grab the inner packing. And right here, what I will do is I will observe the wound. So I will observe the size, the odor, and whether it's granulated, necrotic, or sloughed. So next thing I will do is I will palpate the peri-wound area. And I will palpate and note for any redness, edema, or tenderness. And I will ask Mr. Jones if he feels any tenderness. Mr. Jones, do you feel any tenderness? No? The patient stated that he did not feel any tenderness. So what I'll do now is I will step back, roll this up into a ball, and I will, while pointing to my trash can, I will take off my gloves, and it'll go glove to glove and skin to skin, pointing toward the trash can, and throw that away. So now what I'll do is I will open my dressing change tray, pull this backwards, and take out my sterile field. And I will note that the sterile field does have a 1-inch border, and anything that hangs off the table is contaminated. So now what I'll do is I will grab my kit and I will dump the contents of the tray onto the sterile field. Such. The next thing I'll do is I will come over here, not contaminate my sterile field. I will palm my saline, come back to my workstation, and I will look at the label and make sure it is not expired. And it is not expired. So the next thing I'll do is I'll uncap. I will hold the cap up, and I will pour the saline into the basin without splashing or touching the rim. So now that I have done that, I will take a step back and I will recap. And I will put back my saline right here. So now that I have done that, I will come over here and I will and put on my sterile gloves. I am turning the camera around. All right, so I do have my sterile gloves right here. Pull back that, pull this out. And I note on this, I do have a 1-inch border as well. And I will put on my dominant hand first. So I will pinch right here. Pull this on. And now I will reach underneath the cuff. And now that is on, it is sterile. I'm going to adjust. I am moving the camera back around. I know I have sterile gloves on, but I do need to move the camera back around. Perfect. So now that I'm back to my workstation, I'm going to organize the contents of my sterile field. And ABD pad. Okay. So now that I have my contents organized, what I'm going to do is I'm going to soak my gauze into the saline. 1. So now that I've soaked my gauze into the saline, what I'm going to do is I'm going to clean the suture line from least contaminated to most contaminated. So I will grab my gauze and I will squeeze out the excess saline. And I can do this on here or over the trash can as well. So now I will grab this and I will do a mushroom. And I will do this and make sure that my gloves do not touch the patient. So I will go from least contaminated to most contaminated. And I will dispose. Same thing, grab another, squeeze out the excess saline. And the least contaminated is going to be right down the middle. Squeeze out the excess saline. Now what I'm going to do is I'm going to get a dry gauze and I'm going to pat the suture line dry. So here's our dry gauze. And dispose. So now what I'll do is I'm going to pack the open wound. So squeeze out the excess saline. Now, instead of mushrooming, what I'm going to do is I'm just going to fluff the gauze. Here. And pack. Same thing, just squeeze out the excess saline. And pack. So now I'll come back over here, I will grab a dry 4x4, and I will cover the top of the wound. And now what I'll do is I'm going to grab my ABD pad, and I'm going to make sure not to touch the bottom, just the top, and place right there. So now that I have done that, I will be taking off my sterile gloves, and it'll be the same thing, facing down towards the trash can, glove in my hand, and skin to skin, and dispose. So now what I'll do is I will grab my tape, and I will be taping the ABD pad, and I will be sure to measure it out first. Okay. I'll be doing this to all 4 sides as well. Okay. And now I note that usually I would use another piece of tape on top of the ABD pad. I would write my initials, date, and time, so the next nurse that comes to check the wound would know who did it and when was the last time that the procedure was performed. So now what I'll do is I will put the bed bag down to a comfortable a comfortable height. I will raise up this side rails, and I will ensure that my patient is comfortable as possible and pull back and cover him back up with the linens and the gown. So now what I'll do is I will just perform hand hygiene, and I will dispose of all my trash, and I will go to the nurse's station and I will document the intact suture line, the open wound, and how my patient tolerated the procedure. And that concludes my hand hygiene and wound care checkoff.